Welcome to Section 5 of the Sports PPE video module. In this section, we will cover some practical tips to the sports PPE and also review some case studies with you. So the purpose of this section is to look at some practical tips for conducting sports PPEs, to kind of wrap up what we've learned so far, and also to look at specific abnormal findings and how we would address them. So something that's really crucial in these sports PPE events is time management. Now, we are processing anywhere from 100 to 300 athletes in one given event. And so working as a team and working efficiently is really, really important. You'll have some leaders, your faculty supervisors will be there to help help you divide up into the different stations, but you're going to want to strategize for effective time management during these exams. You'll prioritize your tasks to ensure thoroughness without delays. And what this means is essentially you will be prepared to do what you need to do to help keep the process rolling along. You'll also have to keep an eye out for bottlenecking. So sometimes certain exams take longer than others. And so you'll want to be really flexible and willing to step up and change stations as needed to help clear the athletes through. This might mean that in the heart, lung, abdomen exam, that some PA students will listen to the athletes while they're standing and some will listen while they're supine. Just in case there's not enough benches for the laying portion, you can kind of tag team that section. It might also mean that once ENT is kind of cleared out, that you move to a different station. So just be flexible and communicate well with the other members of your PA team that will be on site with you. So again, communication is key to having successful sports PPE events. You'll want to explain your findings and recommendations to your student athlete well, also your instructions for what you're going to do and how to perform the different exams. You want to listen. You want to show that you care. These are young kids. You're essentially role models to them. So you want to definitely make sure that you are being empathetic and listening to anything that they have to tell you. You'll also want to coordinate with your team, like we've talked about throughout all of these sections in this module. You want to coordinate and you want to be able to communicate effectively. So difficult situations come up. Sometimes, these are teenagers and young, middle school athletes. And so sometimes they might decline to have the exams done. If a student athlete declines to have an exam done, do not do it. Get your PA faculty involved. Maybe it's just a matter of communication, education. And if at the very least, we can always discuss with their parent. It's important, just like with any other role that you have as a PA or a PA student, that you utilize conflict resolution skills to help with any misunderstandings. You want to stay calm, professional, and move through them accordingly. All right. So best practices for documentation. You want to document accurately. So you want to make sure that all findings are documented appropriately. You also want to document using medical terms. So you don't want to say red ear. You'll say erythematous tympanic membrane. So you want to start learning the lingo. If you don't know exactly how to document something, just ask. We'll be happy to help you out on site on these sports PPE events. And it's actually a really good opportunity to learn the proper documentation for abnormal and even for normal findings, although you don't have to document anything that is normal. If something is normal, you'll just sign off on that section of the station. Make sure that your language is clear and descriptive. So if it's on the right only, document right. And you want to be just as accurate as possible when you do that. So ethical considerations. Now we're doing these big events. Again, we're having lots and lots of student athletes all in the same shared space. So you definitely want to try your best to maintain confidentiality. And what this means is trying to set the station up so that you can ensure that you and the student athlete are having a one-on-one conversation and that you're not exposing them or putting them in a position where they feel uncomfortable. This is especially important in the hernia or genitalia section for the boys because it's a particularly vulnerable exam. One other thing to mention is for the most part, we don't need to be lifting up shirts or listening under shirts when we're talking about the thorax or abdomen exam, unless we hear or see something abnormal. Make decisions best based on the student athlete's best interests. And if you have any doubts or any issues, always get your PA faculty involved. All right, this is an opportunity for us to look at some case studies related to abnormal findings we might encounter while doing our sports PPEs.
Case study 1 is an athlete who presents with a previously undiagnosed cardiac murmur. So when you have this kind of presentation, it's very important to reassess and confirm that the murmur is present. Then you'll reach out to a supervising PA faculty to come on over and take a listen as well. If indeed the murmur is present, then the notation is made on the physical exam portion of the form, and consultation with the checkout provider will be necessary. The checkout provider will conduct a detailed assessment and will likely refer the athlete for a cardiac workup with a cardiologist. If no immediate concerns are found, the checkout provider will make a notation or select the item that states cleared after completing evaluation or rehabilitation for. The athlete will have to see the cardiologist, and clearance will then depend on the cardiologist's evaluation and recommendations. Now, as a side note, occasionally we have athletes who have history of a heart murmur, who already know that they had one as a child, or maybe they have one currently. They will either report this themselves, or maybe the parent made note of this in the medical history. This will need to be handled on a case-by-case basis, and the athlete's history and exam should be evaluated carefully to determine clearance for this athlete. Case 2 is an athlete who has elevated blood pressure readings during the sports PPE. These athletes, you'll want to recheck their blood pressure manually on both arms after allowing them to sit and rest for a few minutes. You'll want to check a few things. You want to check, number one, is the cuff size the appropriate size? Are you using proper technique? You need to make sure that the athlete's feet are flat on the floor, that they're in sitting position, and that their legs are not crossed. Also, you want to think about causes for elevated blood pressure. So you want to think about stress. You want to think about caffeine. Did this athlete just drink a Red Bull or a Coke? Or did they maybe just come in from running a mile outside? You'll want to consult with the checkout provider and to determine if need for further evaluation. If no immediate concerns, then the checkout provider will make notation and select the item that states cleared after completing evaluation or rehabilitation for, and this athlete will need to see primary care provider for further evaluation and management. Now, it'll be beneficial to educate this athlete on lifestyle modifications. Really, anyone with elevated blood pressure should be educated on these lifestyle modifications, and that would be low sodium diet, exercise, and stress management.
All right, now let's take a look at case 3. So in case 3, our scenario says that we have an athlete that fails the vision test but has no history of vision problems. So this is a pretty common scenario that we might encounter. The discussion that we want to talk about is reassessment. So we want to talk to our student athlete and see, did you just wake up from a little nap, or did you have something in your eye? Was it itchy? We might even need to recheck their visual acuity if we are concerned that maybe the findings were not accurate. And then we'll also want to pair this up with a comprehensive eye exam to see if we find any other abnormalities that are related to the failed vision test. So we'll want to to also let our PA faculty know if we find anything abnormal. As far as the consultation, the checkout provider will really be the one to determine if further evaluation is needed. And really, it's pretty simple for a failed vision test. If they fail the vision test, they cannot be cleared completely until they are assessed by an eye specialist. So recommendations, the checkup provider will let the student athlete know and document that they must follow up and have this exam done. Um, they will mark cleared after completing evaluation, and then they'll mark in there the eye exam and what the student athlete needs to have from their physical exam findings to be able to pass and be cleared to participate. And last but not least, corrective lenses. So lots and lots of student athletes wear either glasses or contacts, and it's not an abnormal thing for them to accidentally forget their glasses at home, or maybe they're not wearing their contacts that day. So if that's the case, and it's early within the thing, the best thing is if it's in their locker or wherever, have the student athlete go get their glasses if they're able to, or have the parent bring them up. It's always best if they do have these corrective lenses or glasses to try to get that exam done during the period of the sports physical event. That way we can just get them cleared and get them going. Otherwise, there's steps that they have to do after the event so that they can get cleared, and it just puts more burden on the parent and the student athlete. But if that's the case and they can't retrieve them before the end of the event, then they'll just have to either follow up with the optometrist or with the the athletic trainer, whoever is in charge of collecting their UIL forms to make sure that they're cleared. All right, so the last case we're going to look at is one that we will see down here in the Rio Grande Valley. This is the scenario is we detect a case of acanthosis nigricans during the skin examination. Now, acanthosis, as we've discussed prior, is a velvety kind of hyperpigmentation or darkening of the skin, usually found in the neck area, posteriorly most often, sometimes underneath the axilla or in other spaces. Now, I like to look for acanthosis while I'm listening to the heart and the lungs, because I'm there, I'm listening, I'm on their right side, and I can kind of peek at their neck at that point. Now, there is a dedicated section in station 2 that assesses the skin. But again, I'm doing it as I'm doing my exam. And sometimes I might even notice acanthosis in the general appearance, and I will document it there. So essentially, if we identify acanthosis, we want to ask the student athlete about any underlying conditions such as insulin resistance or diabetes, which can be an indicator is acanthosis. The checkout provider will determine if further evaluation or lab work is needed. You'll find a lot of student athletes that have this, and it's a good opportunity to let the parent know, hey, we found this, they need to follow up, have some lab work done to assess for any type of insulin resistance or diabetes. Most of the time, these recommendations can be documented and educated to the student athlete, but I also like to inform the parent if it's a new finding. Follow up, they'll need to follow up with their primary care physician or pediatrician to make sure that they are evaluated and managed properly. And then, as far as the checkout provider is concerned, usually these student athletes can be cleared to play sports without any conditions. However, it is really important to document need for follow up for further evaluation. All right, so those are just a few cases just to kind of see how the process goes from the physical exam finding through to the clearance and the follow up. So hopefully those were helpful to kind of give you that full circle bird's eye view of the process. As far as summary and key takeaways, let's recap some of the main points of this section. So practical application, it's really important, like we said at the beginning of this part of the lecture, is we need to time management appropriately. We need to communicate effectively. If we have any difficult situations, we need to be professional and get our PA faculty involved if we have any issues. We also need to try our best to maintain patient confidentiality. Hopefully, as we grow and we see more cases, we'll be able to recognize abnormal findings easier, and understand the decision making process that goes through, so that when you find these physical exam abnormalities, you can kind of understand how that will see through to whether or not the athlete gets cleared. And then next steps is just continuous learning, self-reflection, and feedback, which we'll discuss in the next section. All right, so next up, you'll have a post-test comprehension to assess your understanding of Section 5. And then after that, we will review the final section of this video module, which is the review and reflection section, where we will kind of summarize the roles and responsibilities that we've talked about throughout this entire module, and kind of summarize and have some key takeaways that we can take with us in preparation for doing these sports PPE events. Again, if you have any questions, please feel free to reach out to us via email. We'll be happy to answer them for you. And we'll see you in our last section.